I'm Elsa Marziali. I'm a senior scientist in Clairou Research Division at Baycrest. My research over the last 10 years has primarily focused on developing e-health technology-based intervention programs for caregivers of people with neurological diseases such as dementia, Parkinson's, stroke. And we have, during that time, built a robust platform for providing online support groups to the caregivers. It is well known that caregivers often do not receive the support they need to manage caregiving tasks in the home, and their health also deteriorates as a result. So the purpose of our program is to provide the support, make it readily accessible by having it online so that they can log in and communicate with other caregivers from their home. What we found is that caregivers manage the tasks of caregiving in terms of hands-on feeding, bathing, those sorts of things, but have much more difficulty dealing with their emotions around the caregiving issues, but also, especially with dementia, they're psychologically losing the person that they had known either as a spouse or as a parent. And that has a great impact psychologically. And the support groups help them deal with those emotions. We don't really understand why patients do not adhere to the prescribed rehab program. So what we're doing in another part of our online programs is meeting with people or patients with chronic disease and exploring what are the barriers to adherence. Are they economic? Are they social? Are they cultural? And then move into a problem-solving mode to help them to get back on track in terms of rehabilitation behaviors. So if we took that program in combination with the caregiver program, we are really offloading a lot of the expense to the healthcare system to the family managing more effectively chronic disease through self-management and through the caregiver. The caregivers and self-management of chronic disease save the healthcare system billions, literally billions of dollars in North America. And yet, we do not provide sufficient support services to them. And I think our e-health programs are one way that we can provide that kind of support, and that is readily accessed by both patients and caregivers, and does not involve any more clinical time than would be a program face-to-face in a clinic.